broadcasting live from Houston, from the space city to the world. You are watching NowMedia Television.
Hi, I'm Dr. Suzanne Manzi. Welcome to the Pain Diaries. Performance pain and sports medicine, we work as a team to make sure patients' needs are addressed so they can be their most functional selves. Dr. Wiederholz and I are a two-doctor practice. My partner, Dr. Wiederholz, and I are both medical doctors with board certifications in multiple disciplines. You ask, what is board certification? Why is it important to see a doctor that holds a board certification? Board-certified physicians demonstrate their desire to practice at the top of their profession. We strive to deliver the highest quality of care to our patients. We're trained in our respective fields and we uphold our training through lifelong learning. Usually our boards have to be recertified every 10 years, or we study along the way to prove that we stay up to date with the literature and information for the best patient care. We're both physiatrists. We're both pain management doctors. We also have individualized interest, where Dr. Wiederholz holds board certifications in sports medicine, as well as anti-aging and regenerative medicine. I hold certification in electrodiagnostic medicine, a specialized form of nerve and muscle testing. I'm currently also studying to become board certified in obesity medicine. We're hopeful to start offering these services in 2023. It's time to go to a commercial break. Remember, you can follow us on Facebook, Instagram, and LinkedIn. To make an appointment, dial 346-217-1111 or email info@performancepain.com. When we come back, you're going to tell you why you want to come to a pain management doctor. Be right back.
Did you know your clients will decide to do business with you and your company within 15 seconds of browsing your website, your social media, and your digital footprint? In addition, your company's reviews will play a major role in client retention and future referrals. Hi, I'm Mike Moran with Digital Dimensions, a WSI agency. We use the latest digital marketing expertise, technology, tools to meet all your company's online marketing challenges. Digital Dimensions is your one-stop solution for social media and content marketing to website rankings and everything in between. Additionally, we have the know-how, knowledge of current trends, and effective SEO technologies, as well as cutting-edge tools to bring leads fast and effectively. Most importantly, we deliver innovative digital marketing strategies customized to your company's exact needs. Take a decisive step. Combine our powerful tools with your company's products and services and increase your revenue now.
At Performance Pain and Sports Medicine, we want to tell you our story. We love what we do. Dr. Wiederholz and I met a long time ago in 2006. He was already a resident in physical medicine and rehabilitation at Baylor College of Medicine, and I was starting my residency. He was one of the chief residents. We were both on our path to doing great things for people. We both went on to pursue fellowships, further study in the field of pain medicine. He went to Georgia and I went to Michigan State University. Originally, he opened his flagship location at Performance straight out of fellowship in Lawrenceville, New Jersey, where he managed that practice and continues to manage a successful practice there. His wife, who's a Texan, wanted to become closer to family, and I, after being employed by a hospital and then being an associate with somebody else for a few years, decided it was time to open my own shop. Although I have kept my academic appointments at University of Houston in the Medical Center, Dr. Wiederholz and I teamed up, and Performance Pain and Sports Medicine was born in June of 2016. Dr. Wiederholz, can you tell me more about joining together with me and building our practice?
Sure. So in 2015, we decided, my wife and I, to move back to Houston, which is where I did my residency program at Baylor. And essentially, it took about a year to get the office up and running, because we had to do a fit out for the space. And once we got the practice open, everything was humming along, and your practice, which was already a very busy practice, just transitioned over. And we teamed up because things got even busier than they were when you were in solo practice. And so I went and joined you and started seeing patients. And since then, it's been a wonderful experience.
Thank you. It's been a great time. I can't believe it's been 6 years already, and you know, there's so much more on the horizon. We're in our 6th year of practice together, and I feel like we're just scratching the surface. There's so many non-surgical approaches that we employ in our practice that allow us to treat patients from a functional standpoint, to keep them on their feet. The most important being, you know, those small business owners that need to be functional. They need to be at their peak condition in order to conduct business properly. So business owners, kids age 14 and over, all the way up to 100-year-old patients is who we treat. Can you tell us a little bit more about your favorite thing to treat?
Certainly. Well, as a pain specialist and sports medicine specialist, I enjoy really treating everything, anywhere that someone may have pain. However, my passion is probably most at treating spinal pain. And so there are a number of procedures that pain specialists are qualified to perform to help folks with their spinal pain. But I would say the thing that I'm most passionate about at the moment is regenerative medicine. And so utilizing alternative therapies such as stem cells, platelet-rich plasma, and the disc seal procedure, which is a sealant for the discs to halt inflammation coming from the spine, from inflammatory discs. These are non-surgical techniques to try to manage someone's chronic spinal pain. And that, I think, is what I'm most passionate about currently.
That's awesome. So what drove you to do an A4M fellowship in anti-aging and regenerative medicine? It seems like that's such a different field than pain management. However, after reading about it and practicing side by side with you over the years, it really is phenomenal on how we can change patients' lives for the better. Can you elaborate more on how you integrate this in the functional medicine into our practice?
Certainly. So it was a number of years ago that I started seeing patients, particularly middle-aged male patients, with back pain. And at the time, I had a team of physical therapists and chiropractors who did a really wonderful job managing patients with back pain. And it turned out that these folks continued to suffer from pain despite really great therapy. And then I would get an MRI, and it would essentially be normal. And I would scratch my head thinking to myself, well, there's nothing wrong on the MRI. They've been through 8 weeks of rigorous physical therapy, and I couldn't quite figure out what was going on with them. And I started testing them for testosterone. I had gone to a lecture on low testosterone, and some of the symptoms happened to coincide with the things that I saw: back pain, knee pain, joint aches, those sorts of things. And so I started checking. And I noticed that many of these folks had, in fact, low testosterone. At that time, I was referring a bunch of patients out to a local primary care doctor who would manage their low testosterone. And they would come back and they would feel great. And I said to myself, wow, that's a lot of patients that I'm referring out that I could be helping inside my own practice. And so I decided to seek additional training. And that was essentially a 2 to 3 year fellowship in anti-aging, regenerative, and functional medicine, which I then subsequently became board certified in that field and did a master's degree in metabolic and nutritional medicine. And that now has equipped me with the abilities to manage complex hormonal imbalances and help these folks get well in a natural way.
Thank you so much for that. It has been an amazing journey in learning these techniques and the science behind all of this to help patients' pain and improve their functional quality of life. I am really excited that you share my enthusiasm too, and especially in educating people about what we actually do. Why is our field of pain management so important?
Well, the field of pain management is incredibly important because chronic pain is, or acute and chronic pain represents such a huge problem in this country. Back pain is one of the top reasons to visit your primary care physician. And the lost productivity and lost days at work for people suffering from just back pain alone is astronomical in this country. And so having a specialist who utilizes non-surgical techniques to get people back to work and functioning, I think is really ultra critical for the productivity of the workforce and just overall wellness in our patients.
Thank you for that. You know, the spectrum of back pain is really interesting. Back pain, neck pain, all the joint pains that we see. Some people just think, oh, I just have to go to the surgeon and get an injection and I'll be better. You know, steroid needs to be used cautiously. And really over the past few years, we're really lucky to be on this quest for knowledge as well as the ability to treat our patients with what we now have to offer. Can you elaborate more on the higher level techniques that we perform at Performance Pain and Sports Medicine to help our patients?
Yeah, that's a really exciting part of our field right now. We are living in a time that the field of interventional pain management is evolving rapidly. This is not unlike the field of cardiology when interventional cardiology was developed, when the cardiac stent was invented and cardiologists now started placing catheters into arteries and putting stents in blood vessels to open up those blood vessels that before would require open heart surgery. That's very similar to what we're seeing now in the field of pain management. Interventional pain physicians are learning complex techniques that are bridging the gap between simple injection treatments and major surgery. So now we have these minimally invasive procedures that allow us to take treatments to the next level. So starting with basic injections and then even advancing to minimally invasive procedures that interventional pain physicians are able to implant in a minimally invasive fashion versus an open procedure. For instance, let's look at just spinal stenosis. Spinal stenosis is a debilitating condition that affects mainly elderly individuals who are suffering from arthritis in the spine. And as that arthritis progresses, the spinal canal becomes narrowed. And in the past, that required a big operation to open up the spinal canal, remove the bones that were pressing in on the spinal canal. Now, certain patients are able to get a minimally invasive procedure, such as the mild procedure, minimally invasive lumbar decompression, which is a decompression procedure done through a tiny, tiny little keyhole. It doesn't even require any stitches. And we're able to remove ligament tissue that's compressing the spinal canal. That's just one example of a procedure that is now in the hands of interventional pain physicians that is preventing major back operations and bridging that gap.
That's really amazing. I am so excited to share all these different technologies that we offer in our coming episodes. I even said to a patient yesterday, you know, I don't just have to prescribe you pain medicine anymore for your knee pain after you had your total knee replacement. I have so many options now. And they looked at me baffled, and I couldn't believe it, that a lot of people don't realize that there's so many options now where you don't have to live in pain. You can be functional again. You can go out dancing again. You can play with your grandkids and your children and, again, conduct your business to the highest level that you can possibly conduct it at, as long as you feel well. I was going to ask you as well, what do you think performance pain and sports medicine, why do you think we're so unique? What do we bring to the table? You always tell me you love what you do, and you know that I love what I do. Why do we continue to love what we do when we see burnout happening around us everywhere with other physicians and other specialists?
Yeah, I think the main reason why both you and I are so passionate about this field stems from that thirst for improving ourselves and constantly learning new things. There are so many physicians that receive their training and then just simply do what they were trained to do, not evolving. This field is rapidly evolving, even in the 10 to 15 years that we've been in practice. And so if you stay on top of things, there's always new procedures that you're learning. Take, for instance, the Vertiflex procedure, another treatment for spinal stenosis. You and I were the first male and first female physicians in the state of Texas to perform that procedure. That shows you the drive that we have to picking up new skills, learning new things, and incorporating that into the treatments that we offer our patients. And so the fact that we're constantly improving, I think, keeps things fresh and exciting. And I think that's the main reason why we don't burn out. We just continue to add new things that keep this field so exciting for the both of us.
I totally agree. It's really unfortunate to see a lot of our colleagues being frustrated, but as you and I are both owners of our own destiny, I like to think of it as, we own our own business, we own our own practice, and we can practice medicine the way we want to. And we do it for the best patient outcomes. We treat our patients as if they're family. We explain things to them, we spend the time with them, and it really is an honor to be a physician. But the more I do this, the more I love what I do, and I know you do too. And it really, it makes my soul feel good, and I know it makes you feel good too. We're always looking for the most optimal outcome for our patients, our staff, our family members, or whoever we treat. But we treat everybody like family at Performance. The other thing I wanted to ask you, you've done multiple board certifications, and this quest for knowledge continues. Do you feel like you're going to be doing any further certifications?
I don't know. I think at the moment, I feel as though I've probably done as much as I would like to do from an education perspective, but who knows? I mean, just look at yourself. You probably thought with 3 board certifications you were good to go, and now you have a new passion with obesity medicine. And so who knows if something similar is going to pop up, and I may have a whole new passion down the road. But at the moment, I think with 4 separate board certifications, I feel as though I'm offering my patients about as much as I can offer them, from traditional treatments to alternative treatments to even natural therapies. And I think that it's really well-rounded. And then adding what you have to the practice just further justifies that I think from a practice perspective, really no one offers what performance pain and sports medicine offers.
I agree. Again, we're really lucky to do what we do, and it's so exciting that we're on the forefront of these cutting-edge technologies that are now available to us. Is there anything else important you'd like the audience to know about us?
Well, I think it's important to kind of know some of the behind-the-scenes things. Dr. Manzi and I both are very passionate about travel, and we support each other tremendously. That's part of the reason we don't burn out. Travel is our rescue, and When Dr. Manzi feels the need to get away and to relax, I'm there to cover the practice. And vice versa. Travel is also my main outlet for relaxation. And so being able to get away and have someone taking over the practice and keeping the patients well taken care of, I think is such a critical thing. I'll just share briefly, in 15 years of private practice, I had never taken a 2-week break from my practice. A week was the maximum time that I ever took away. But now that I have a practice with a partner that I can trust and a practice that is so well run, I felt I could get away for 2 weeks. And that was just a really nice break for me and my family to be able to spend that kind of time away from work. And I just think that that's a wonderful thing. And the patients were well taken care of despite my absence and vice versa.
I completely agree. Thank you so much for that. I'm honored to be your partner, for us to continue with performance pain and sports medicine for the future, taking care of patients and making everybody as functional as possible. Remember, www.performancepain.com. Follow us on Facebook, Instagram, and LinkedIn. To make an appointment, 346-217-1111 or email info@performancepain.com. Remember, take care of you so you can take care of business.
Buying, selling, or renting a property is an important step that will impact your life and the life of your loved ones. In fact, research shows having an experienced realtor ensures a better pricing, selling, buying, or renting a property. Hi, my name is Dina Mesby and I'm with Compass Real Estate. We have the right team and the strong know-how to navigate your transaction with ease. We can help you buy properties, whether it's for your primary residence, an investment property, or even a vacation home. We are a full-service real estate team that can provide market evaluations and assessments, suggest renovations needed to make your property shine through our concierge service with no upfront cost to you, staging and personal organizers so your prospect buyers fall in love with your home, and any other things needed to list your property and sell it as fast as possible. Additionally, I'm a master certified negotiator and can provide you several funding and financing solutions. The goal is to sell your house fast or find you your dream home for the best price. You can reach me at 281-935-6993. Let my team take care of all your real estate needs.
Hi, I'm Patria Leone. I believe in every single thing that I do, and I want you to do the same. You deserve to look and feel beautiful or handsome. Be empowered. You're entitled to be at your best mind, physical, and financial fitness. As the CEO of Health for Wealth, I've developed a 4-pillar method based on your mindset, overall health and wellness, relationships, and finances. All of these are the foundation of your life, and they integrate whether it's in your business or your personal life. I've been down and I've had some strong struggles and challenges, and I'm convinced that every habit and behavior creates your choices, and you become the sum of your choices. You want to feel better, look better, eat better, think better, work better, love better, perform better, be better. What are you waiting for? Remember, you have only one life, one body, and one mind. And there's a solution to every circumstance, and it starts with you. It's time for you to take charge and thrive now. Invest in yourself. To schedule your free 30-minute consultation that has every potential to change everything, call now at 602-910-1340 or visit forhealthywealthy.com. You can follow me on Instagram at Patria Leone or follow me on Facebook at Health for Wealth LLC. And don't forget to check out my podcast on YouTube at Health for Wealth.
Welcome back. We're here at the Pain Diaries. Dr. Matt Wiederholz and I are here to talk about why do you want to come to a pain management specialist? So over the years, pain management has had a bad rap in the United States. Some people have a negative connotation when it comes to seeing a pain doctor. Why do I need to go get pills? Why do I need to see a pain doctor? And I just need surgery. I just need to get better with surgery. And I don't want to be hooked on opioids. So I'm here to educate you all on what we do. Now, pain doctors are the bridge between your primary care doctor and the surgeon. Our goals at Performance are to treat you, to keep you functional. And if you really need to have surgery, we refer you to a surgeon. We know amazing surgeons, and we work collaboratively with them. Dr. Wiederholz, can you add to this about what's been going on over the past few years with the opioid epidemic, and how we are trying to curtail that, and then also add to elaborate on why we refer to surgeons when we need to?
Yeah, I think this area, it's a complex topic because we're talking about opioids. The government has involved themselves in pain management over the years. If you think back, you may remember during your med school days that pain was the fifth vital sign. And so hospitals were graded on how well they performed at managing people's pain while they were in the hospital. And so there was a huge push to make sure that patients' pain was adequately addressed when they were in the hospital. And that bled over even into the clinic. And so the use of opioids just skyrocketed. And as a pain physician, we are obviously the most well-equipped at dealing with both acute and chronic pain. And that doesn't necessarily mean the use of opioids. If you look at the specialties that are most known for prescribing opioids, pain physicians are way down on the list. And so the primary care offices were flooded with people demanding that their pain be better controlled. And so opioid usage just went through the roof. Then came interventional pain management. And so Dr. Manzi and I, as interventional pain physicians, offer alternative solutions, things that don't involve just popping a pill, and trying to actually get at the root of the problem. And so if you have, say, a bad disc that's causing inflammation and irritating a nerve, we can actually place a small amount of medication directly on the problem area and solve the issue most times without the need for dangerous medications that may cause addiction or other side effects and problems. Additionally, you don't need to jump straight to the surgeon because many of these conditions are easily treated with a combination of injection treatments and physical therapy and other modalities. And I think that as interventional physicians, that's really what we're pushing, is a move away from, hey, just take these 2 pills and call me in the morning, versus let's try to get to the root of the problem.
Absolutely. Like I mentioned earlier, we work with surgeons, and if you have to have a surgery and need pain control, we're there for you. But our ultimate goal is always to hopefully prevent that spine or joint surgery. One of my favorite procedures is neuromodulation, and I know you're very passionate about this too. Now the question is, what is neuromodulation? Neuromodulation is basically tricking the nervous system to think that your pain is felt differently. It's almost like a filter between your brain and where the problem is. Now, neuromodulation can be in the spine or over the joints now. You can treat a nerve that goes to a joint so your brain doesn't think that joint is painful anymore. Again, so many different options these days are available to keep people functional. And it's really amazing with small little incisions and or, like you mentioned, a keyhole type procedure. where you don't even need sutures sometimes, where we perform these minimally invasive procedures so you don't actually have to have a large operation on your back or joints. It's really been an experience to learn all these techniques, and we're very proud to serve our patients and offer these technologies to them. The other thing I wanted to ask you, with neuromodulation, maybe you can elaborate more on spinal cord stimulation and the different types of spinal cord stimulation that we utilize in our practice.
Of course. Spinal cord stimulation is essentially targeting nerves in the central nervous system, so in your spinal cord. There are receptors that control pain in various parts of the body. And so one of the most common ailments is low back pain. And oftentimes, patients that present to an interventional pain physician have already had prior back surgery, and they may still be suffering with chronic back and or leg pain. And with the implantation of a tiny little device, it's about the size of a spaghetti noodle, that little wire or spaghetti noodle can deliver electric impulses to the nerves to essentially block pain signals. And so instead of dosing medication, we're actually dosing electricity in order to modulate the central nervous system. And we do that in an effort to reduce pain. And what's been found in recent studies is that about 84%, 80 to 85% of patients respond favorably to that type of stimulation. And so that's an incredible number of responders to that therapy. You can't really say the same thing about most medications. Most medications, in fact, get approved by the FDA for very marginal benefits over placebo, but an 84% responder rate. And in those same studies, there was about a 7 out of 10 chance that you would be a profound responder. What does that mean, to be a profound responder? Essentially, that means more than 80% pain relief with this therapy. That's incredible. That's essentially total elimination of your pain with just a small implantable device that simply stimulates the nerves of the central nervous system to block pain in your back and legs. I think that's incredible.
Absolutely. It is one of our favorite procedures to do because the patients know almost immediately that their pain is relieved, and they're just so thankful and grateful. One of my favorite things to do is put the lead over that little nerve root, and when they have specific pain called complex regional pain syndrome, this is really targeted spinal cord stimulation. It's electrical signals over that small nerve root, and it can deliver pain relief for a very specific reason, whether it be foot and ankle pain or knee pain from a surgery, hip pain. I have a patient that had a femoral artery catheterization, and the femoral nerve was cut by accident, and he's had continued leg and knee pain. And he's just had tremendous relief with this new therapy that we have to offer him when it comes to neuromodulation. One of the other types of neuromodulation we use frequently is, like I mentioned, stimulation over the nerves that go to joints. Can you tell us some of your go-tos for shoulder pain, knee pain, SI joint pain as well?
Of course. Using neuromodulation, and that's a fancy term, neuro for nerve, and modulation I think is pretty self-explanatory. Using that type of technology outside of the central nervous system now opens this technology up to a plethora of ailments. And so you mentioned shoulder pain. Let's just focus on that, for instance. There are tons of people who have had shoulder surgery or shoulder replacement even, who continue to suffer from chronic shoulder pain. What can be done for these people? There's little that a surgeon has to offer. They've already done the operation and there's still pain. Well, the good news is that the shoulder joint is innervated by nerves, and those sensory nerves control whether you feel pain or not. And those sensory nerves are now an area that we can target to block, either with injections or with heat or cold therapy, or in this case of neuromodulation, using a device to stimulate that nerve in order to modulate the signals that are coming from that nerve. And so instead of your body and your brain interpreting those signals as painful, that's now dampened down, and now you don't feel it as such severe pain. And I think you as well have had tremendous success with these therapies and taken patients with just long-standing chronic shoulder pains to essentially elimination of their pain.
It's been phenomenal, the results that we've achieved at Performance Pain and Sports Medicine using these technologies. And I'm so grateful, again, to be part of this revolution in the pain world. And being a pain physician has never been what it was in the past. Now we have all these new technologies that allow us to keep people going and keep them functional and reduce their pain levels. On another note, the other thing I love about what we do is, like you mentioned earlier, we treat degeneration of discs and or cartilage. And so using regenerative medicine, it's another great way to keep you out of the surgeon's office. Instead of having things cut out or repaired by a surgeon, we can repair things with just a needle, an injection of regenerative type medicine. Can you elaborate more on what we utilize for regenerative medicine?
Yeah, regenerative medicine is an exciting field. You see a lot of buzz these days about stem cell therapies, and there's just a lot of confusion out there on what these therapies are, what is a legitimate treatment, what is not. Regenerative medicine is actually not a new field. George Hackett published the first book on prolotherapy, or proliferative therapy, which is a form of regenerative medicine using sugar water or dextrose back in the 1950s. So this therapy's been around for a very long time. I myself have been doing regenerative medicine for 15 years now. So this is a long-standing passion of mine. And as we mentioned earlier, one of my board certifications includes anti-aging, regenerative, and functional medicine. And so a field that is completely focused on rebuilding or regenerating the body. And that type of therapy can be applied in orthopedics in a way where instead of using medications that cause further degradation of the joints, or using surgeries that cut out pathologic tissue or degenerated tissue, we're going to allow the body to naturally heal itself. Well, how do we do that? First and foremost, the two of us, we focus on nutrition. So that's a big part of success in regenerative medicine. All too often, I see clinics that offer quote unquote regenerative medicine, and all they do is a shot. They don't talk to the patient about their nutrition. They don't optimize hormonal balance. As we age and we degenerate, we also see a decrease in our anabolic hormones. And so things like testosterone, estrogen, progesterone, these are anti-inflammatory hormones that in our youth are in optimal ranges. Well, it's no surprise that in our youth, we're not degenerating and we're very healthy and our joints aren't aching. Well, as we age and these hormones decrease, inflammation takes over. And just like in cardiovascular disease and cancer, most things start with inflammation, uncontrolled inflammation. And with regenerative medicine, we can utilize growth factors and even cells to stimulate repair of degenerated tissues, of torn tissues. But in order to optimize that, we look at nutrition, we look at hormones, and optimizing all of that for the most beneficial outcomes with regenerative medicine is really critical.
Regenerative medicine has been such a fun field to jump into and learn about. I really have also found a passion for this, because if it was my body, I wouldn't want to have a surgical correction when there's ways that it can be treated and healed naturally. I feel like we're all looking for a way to heal ourselves and to feel better. And in order to not have to take time to recuperate from a large surgery, or have that time off that we just can't afford if we're trying to run a business or trying to spend time with our family and do what we need to do as busy Americans as we are. So again, I love having these treatment options to offer patients, and it's our job to continuously educate them. And education in our office is just a daily part of our job, patient to patient. We're always educating, recommending what people need to stay functional. And another interest of mine is going into this obesity medicine specialty, because again, it's so important. Fat cells are highly, highly inflammatory, and a lot of people don't even know that. And if we can reduce our inflammation overall, we're going to feel better. Like Dr. Wiederholz said, it's of utmost importance to feed your body nutritious food, nutrition, good supplementation, and again, if something starts degenerating, we have the options to fix that from a non-surgical approach. Dr. Wiederholz, can you elaborate more on how we administer the hormone replacement therapy?
So hormones, when our hormones diminish over time, so in women as we approach menopause, and in men the process of testosterone loss in andropause, that process in men can take many, many years, and so it's not as noticeable. In women, we sort of go over a cliff, right? You approach menopause and you start to get all of those symptoms really rapidly, the hot flashes and all of the other unwelcome symptoms. Well, there are a number of ways to replace those hormones. Of course, I always recommend talking with your doctor about these therapies. Some of this can be controversial. However, with bioidentical hormones, these have been shown to be exceedingly safe. There are a number of different formulations. So some folks are taking oral hormones, some are taking topical hormones. But what I'm really passionate about is using pellets. These are subcutaneous, meaning under the skin, implants that last for months. So rather than having to remember to take a pill or put a lotion on your body every day, and the risk of potentially transferring some of those to loved ones from contact, a pellet is inserted under the skin, and it's a very safe procedure, and it optimizes these levels and keeps them in an optimal range for a very long period of time. So you don't have to remember to take your prescription. You simply get the procedure done, and then in most cases for women, 3 to 4 months of hormone optimization seen with pellet insertion. And in men, we're seeing anywhere from 4 to upwards of 6 months of optimized levels of testosterone without the fluctuations of taking a shot or a cream. I think most men who have used topical formulations of hormones of testosterone have noticed that they don't get the tremendous benefit that they feel that they should be seeing just with a topical formulation. But when you put the pellets in, within just a few weeks, the levels are optimized and people are just feeling great.
I really feel it's so amazing when they do come back after they've had their first round, or if they actually go too long and don't get them, they come back and say, I need my pellets, I miss them, I want them. They're so adamant about feeling amazing. It's been a great addition to our practice in adding this therapy to make people's chemistries normalized and optimized. And we're proud to offer that at Performance Pain and Sports Medicine to make everybody feel like they're young again. So on that note, it's time to go to a commercial break. Remember, you can follow us on Facebook, Instagram, and LinkedIn. To make an appointment, call 346-217-1111 or email info@performancepain.com.
Hi, my name is Elias Basabe, founder of Little Maria's Cafe Restaurant in West Houston, located in 2901 Wilkers Drive, Suite 137, first floor. Here you will find a family-friendly and relaxed environment where you can enjoy a delicious homemade breakfast, lunch, and dinner. We know you need to get to work fast, and we want you to enjoy a tasty, quality, and healthy homemade food. So come and visit us for a great nutritious meal at an affordable price. We specialize in tasty breakfasts, deli sandwiches, fish, even barbecue cookouts. Little Maria's Cafe has it all. We only use the great quality of bird's head meats and products. Just like you, we love to get you up early. Little Maria's Cafe is open from 7 a.m. to 4 p.m. You can dine in with us during breakfast, lunch, or dinner, or we can have it ready for you for pickup. Visit us today on the first floor of the CMPC Center at 2901 Wilkers Drive, Suite 137, first floor. Order now at 832-667-8376, Little Maria's Cafe.
Hi, I'm Mike Mogel, the CEO of Clean Sweep Office Cleaning. A clean and disinfected space is essential to keeping your customers and your staff healthy, safe, and productive while preventing the spread of COVID-19. Clean Sweep Office Cleaning, with more than 20 years experience in janitorial, restaurant, post-construction, and floor maintenance cleaning. We really make it shine. We are focused on quality cleaning and wellness in our customer spaces. Our team is professionally trained to ensure not a spot is missed, and we use products that are safe for your property and your people. Our services are tailored to your individual needs and include expert floor care, dusting, sweeping, mopping, vacuuming, detailing, glass cleaning, and deep disinfecting. Our experienced team is here to make your office as comfortable and clean as possible. Visit our website at cleansweepofficecleaning.com or call us today at 832-689-7996. Now that's a clean sweep.
Hello, my name is Colleen Meagle and I'm an attorney. Let's talk business. Do you have a business that you want to buy or sell? It's crucial to get an attorney involved sooner rather than later in any sale process, because the moment that documents are signed, your leverage goes right out the window. So make sure that you get what you really want and protect yourself in the process. So if you're looking to sell, let's talk. I've handled acquisitions for Fortune 200 companies and helped numerous business owners discover how a great lawyer is a partner in a transaction, guiding you through the process and preventing you from making mistakes that can cost you thousands. My goal is to provide my clients with focused, cost-effective, yet practical legal solutions. So let me help you with your legal needs. Call me today, 713-300-9662.
Here, host of the Pain Diaries. I'm here to educate you on pain management. Why is pain management important? Where do we fit into the chain of doctors? I'm a medical doctor trained in the specialty of pain management, and my job is to keep people functional. I always hope people don't need to have surgery. Everyone needs to take care of themselves, business owners especially. They can perform at their peak to ensure their business is profitable and performing well. These are so important to the bottom line. We have to perform well in order to keep our businesses afloat. Keeping ourselves healthy and functional always keeps your business profitable. Pain management doctor may be able to help you in your tip-top shape. Business owners need to be at their peak and cannot close deals when they feel unwell. They must keep relationships at the highest level. Being unhealthy is bad for business and ultimately can be expensive. So my job is to keep people feeling good and functioning. My main training is as a physiatrist. Some people say physiatrist, some people say physiatrist. What is a physiatrist? I'm a doctor who specializes in physical medicine and rehabilitation. Physiatrists can be medical doctors or doctors of osteopathic medicine, either an MD or a DO, and practice in either the inpatient or outpatient setting. Physiatrists provide integrated, multidisciplinary care aimed at recovery of the whole person by addressing the individual's physical, emotional, medical, vocational, and social needs. It's a unique specialty in that its area of expertise is in the function of the entire whole patient, as compared with a focus on an organ system or systems. Physiatrists treat conditions of the bones, muscles, joints, brain, nervous system, and other systems of the body that can limit a person's ability to function. Some common conditions that we treat as physiatrists include amputation, brain injury, cancer, cerebral palsy, dysphagia, multiple sclerosis, and other neurologic conditions, muscular dystrophy, stroke, Parkinson's disease, spasticity and movement disorders, spinal cord injury patients, whether they be complete spinal cord injury or paraplegics, spine pain, sports-related injuries, and osteoarthritis. At Performance Pain and Sports Medicine, Dr. Wiederholz and I work as a team. We make sure patients' needs are addressed so they can be their most functional selves. We hold multiple board certifications in many disciplines. Now, board certification is important. When you see a doctor, you need to ensure that they're board certified. It's important because you know that a board certified physician demonstrates their desire to practice at the top of their profession. It elevates the game. We're the highest trained that we can possibly be when we're board certified, in order to strive to deliver the highest quality of care to our patients. You only want the best, you deserve the best. We're trained in our respective fields and uphold our training through lifelong learning. Usually our boards have to be recertified every 10 years, or we study along the way to prove that we stay up to date with the literature and information for the best patient care. Dr. Wiederholz and I are both physiatrists. We're both pain management doctors, and we also have individualized interests, where Dr. Wiederholz holds board certifications in sports medicine, as well as anti-aging and regenerative medicine. I hold certifications in electrodiagnostic medicine, specialized form of nerve and muscle testing, and I'm currently studying to become board certified in obesity. We're hopefully starting to offer those services in 2023. Now, I've touched on a lot of different things that I do at Performance Pain and Sports Medicine, and the opportunity is endless for you to come, be treated with us, and we take you in like a family member to keep you at your tip-top, most functional shape. At that time, I have to say, it's time to go to a commercial break. Remember, you can follow us on Facebook, Instagram, and LinkedIn. To make an appointment, call 346-217-1111 or email info@performancepain.com. When we come back, we're going to tell you why you would want to come to a pain management doctor again. Be right back.
This has been a NowMedia television feature presentation. All rights reserved.